Hello everybody, welcome back to Instagram Live. I'm Dr. Russo, as you know, and you are in the middle of our lip intensive class. These are the students who've taken the class. They've done, most of them have done introduction to neurotoxin, dermal fillers. They've gotten signed off, and now they're doing lip intensive, which is really just about the lip, because that's really one of the most difficult areas and associated with the highest number of complications, including the occlusions, which we talked a lot about tonight, and I hope you got a bunch of good information about that. But we have Sarah here, who is our lip model. I've not met Sarah before. So we want to put you right in the middle of our lip intensive class so you can kind of see what it's like to be part of it. We just had our Q&A session. Now we're going to do the live demo, and then they're going to break off and inject, 2-3 models each today doing lips. So I wanted to give you guys a feeling of what it's like to be in our class. Mary Kate's doing the recording, so I'm going to just go at it and make believe you aren't even there, and the students are going to be interactive, and I hope you enjoy it. Sarah, how are you?
Good, and you?
Good. How old are you?
23.
23. And I just want them to have a quick look at you. Have you ever had your lips injected before?
Once.
How long ago?
3-4 months ago.
Okay. Do you remember what product was used?
Juvederm.
Which one? Okay. You don't know? That's okay.
I don't.
What happened after the injection? Did your lips blow up? Did they get a little bigger? What was it like for you?
It was a little swollen and it bruised a bit, but other than that.
Okay. So as you look at yourself now, or I guess you did, how are your lips now compared to the way they were before the injection?
Definitely a little fuller, but I don't think
Mm-hmm.
it's okay.
Tell me what you want.
Definitely more of a top lip because I have a smaller top lip.
Mm-hmm. Okay. So you're happy with your lower lip,
Yep.
but you want your upper lip to be made larger. What do you guys think of that?
I think you're probably going to have to put a little in the bottom lip to match, otherwise she'll look funny.
What kind of ratio are you thinking of for a young Caucasian woman? What should her upper to lower?
40-60.
Right. So what we're saying is, if you make your upper lip bigger, we're going to have to probably do something to your lower lip, because your lower lip should always be a little bit bigger than your upper.
Okay.
So just so you know.
Yeah, that's
Yeah. So we got to think about that. We don't know what product was used.
It was definitely Juvederm. I think it was the regular one. I don't know if there's a regular one.
Okay, that's okay. Okay. So you want your lips to be a little bigger, not a lot bigger. Yeah. Okay. Okay. So I think for her, I'm going to use velour, just because I think she'll be disappointed if we don't create enough of a difference for her, and I don't think Glabella can do that. I don't think Kiss can do it as well as Glabella. So we're going to use velour for you. It's another Juvederm product.
Okay.
All right. So let's look at her lips now. So how would you guys describe her lips? What do you think of them? What do you think for a 24-year-old? How's the upper compare to lower? Is it symmetric? Like, what do you see?
I see a little asymmetry.
Where do you see? What do you see?
Yes.
What do you see, Michelle?
This
So-
side is like smaller.
Go ahead.
Yeah, this side is smaller and
This side's
the
smaller?
lip line, yes, this one's smaller.
Have your lips always been that way?
Yes.
This lip side's always been a little bit smaller?
Mhm.
Okay. So that's important to point. I mean, she's already noticing it, but in patients who haven't noticed it, it's important for us to point that out to them, because what if we don't point that out?
It's our fault.
People look at them right away and start getting super focused, and how come this side's bigger? And if you don't have a photo of that, or at least have to let them see that, they're going to say, well, it wasn't that way before, and you're going to be chasing your tail. The other thing is, I think it's important to let them know that, the two sides of the face, the two sides of the lips, develop separately, and then they fuse in the middle, hopefully, or else you have a cleft lip or a cleft palate, but they fuse in the middle. But they're two separate sides, and they're never the same. Your breasts are different, your eyes are different, your hands are different, your feet are different. Everyone's two halves are different. They're two separate halves. And so we can never create symmetry, but we can make them less asymmetric, maybe? So you might have a discussion with her, well, yeah, you see how that isn't quite as full. We may want to put a little bit more product. You let her in on the secret, but we may want to put a little more product in there, and she'll see it and say, oh, I see, I was that way. It just helps them understand that this is their anatomy, not your sort of, not great treatment, right? So we got a little asymmetry. What about the lower lip? Is that pretty symmetric?
It's beautiful. She has like this little, her pillows are like really
Yeah.
plump, and she has this little.
Sulcus, should we call that a little
Yeah.
sulcus? See, I like that.
Yeah, it's pretty.
Because that looks natural and beautiful, and a lot of times people just blow through that, and they create, this kind of like sort of sausage lip, so it all looks the same like that. And I think it's a telltale sign of someone having done it. This is beautiful. Did someone do that here? Was it done here?
Yes, it's
Yeah.
done.
So you were a model for this.
I was.
Yeah, okay. So this is good. So they're listening to what I'm saying, I guess. Okay. So the upper lip has 3 tubercles. The lower lip has 2. So we do these little boluses that I talk about, which I'll show you. It's done in an effort to create that little sulcus and a natural fold. Here we want the fullness. It's almost like a puzzle piece, like it's fuller here and emptier here, so it kind of goes together like that. That's how I think about it. So what should we do for her to enhance her upper lip?
We need to add like a vermilion border on the left side, I think, a little bit.
So you want to create a white roll like here on this side?
On
Is
that
what you're
side,
saying?
yes.
Okay.
I mean, I'm not sure how to do it, but
And I think if you notice that the fullness extends really much farther laterally than here. This side looks like it just ends kind of abruptly. You see that? You see how it kind of just looks like it ends sooner than the other side?
Yes.
And these are, again, common findings. The more you look at people, the more you see everyone has something like this, some difference. But we have to point that out to her. So we're going to try to, she wants me to add something to the vermilion border. How's her Cupid's bow and her filter columns?
pretty good.
Beautiful, so we don't need to do anything for that. So as we get older, and not that she's old at all, how do our lips change? What happens to lips as we get older?
They disappear.
They disappear. Where do they go?
We lost mass. We lost like muscle mass.
Yeah.
So
Yeah.
it become like
Yeah.
inner side.
Right, so this distance becomes greater. Like this is probably like, I don't know, 13 millimeters or something on her. Sometimes it's 16, 18, 20. So this gets longer. This gets wider. Sorry. And the lips kind of get, rolled in, so it gets longer. Less red, and this gets longer as well. If you look at a young person, you'll see most of the volume is in the middle 2/3 of the lip, and it ends quickly and abruptly. As we get older, the whole thing kind of looks sort of at the same width, and it looks flatter, and it just kind of goes like this. And if we take an older person and try to treat the lateral part like we would the middle, we create jokers. We create big, overdone mouths, because people don't realize that a youthful lip kind of is like that, the middle 2/3, and then it ends abruptly. Like, look at her lip, beautiful, and hers. And as you get older, it gets wider and longer. You have a little bit of that. So, in her, I'm just talking about this not because she needs any of this, but just you see what a young lip looks like, and maybe what an older lip looks like, what an older lip looks like, just because of age. So at least we know when we're treating an older patient kind of what our goals are to try to shorten this distance, get some more volume in the middle part of the lip, and create that nice ratio. So someone like this, in my mind, is a pretty easy person to inject, right? Because a little bit of product is going to just blow her up. I mean, she's not going to require much treatment. She's already pretty good. We're just making her better, as opposed to someone who's older, who just needs more structure, more support, more everything, more volume, maybe a more hardy product, whatever. So this is the kind of patient you should all start on. Right? Someone who's already pretty good, who's young, and where a little bit of product is going to go a long way. Right? Okay. Just a word about vertical lip line. She doesn't have any. You've got some. Those are often difficult to treat, but I think the technique for those is really very nice. I usually use a little dental block here, and when I am injecting it, I'm going in at almost a 0 angle like this, very superficial, because remember, when the facial artery comes up and then bifurcates into the inferior and superior labial arteries, it gives up all these columellar branches, so the vessels are traveling straight up toward the nose. And when we're injecting like this, we're right on top of the vessels. So if we're not superficial in the dermis, we could cannulate one of those vessels and get the closest to the base of the nose, side of the nose, whatever. So those columellar branches are all traveling directly off the superior labial, and they're just going like that. So we have to be careful. So here I squeeze the skin like that, so I'm stopping any blood flow, and I've got my needle, and I'm just kind of going like that, and I'm just getting it into the skin. I'm raising a little bleb when I do it, and then when I'm done, I go like that, and it's gone, the line's gone. It's very effective, and then I always have some left over. I'll go behind and do some fanning just to add some support to it. I still try to stay in that same level, that superficial dermal level, and it's beautiful. So, all right, so we do some work? Okay. Come on back. Come on back. You can go anywhere you want. Mary.
Yeah.
Oh yeah, take your photo. Yeah. Not good
No,
today.
you can just look straight ahead on your left.
Stay behind you so you don't have to move anywhere.
Everybody needs an assistant like Jenny. All right, so let's just do a little bit of cleaning. Okay, bring that around just a little bit more so it's more in the front of her. I like the big pads. These alcohol pads are so much better than the little ones.
Yeah.
They're really soaked and they just kind of can clean the whole face if you need to. So you said 3 months ago you got injected?
Yes.
Jenny, do you have her previous record?
Yep.
Ooh, let's find out what do you think it was?
0.8. Is that what you're talking about? Or are
I'm
we
just trying.
talking
Well,
about
I'm just trying to
Juvederm?
think what Juvederm product
Oh.
they use. But they use 0.8 cc's. Is that what you said?
Ooh,
What did they use?
velour.
Not, and I'll only use 0.8, right?
Hmm?
They use 0.8.
Mm-hmm.
0.8 velour.
How much in each? 0.2 in each quadrant.
Well, maybe.
Kinda.
Maybe.
What? I can't see it.
Yeah, it just doesn't have that
Oh.
that much detail in
That
each
detail.
quadrant.
All
But
right. It's okay.
yeah.
All right, so just gonna put your hands back a little bit. So what I'm going to do, normally I use a bed that's more adjustable, so I would have her up a little higher. I'm gonna have to kind of go down a little bit to get her, but I'm gonna just kind of rest my I'm gonna rest my hand on her shoulder. I'm gonna bring the skin up to my needle, like that. And then I'm gonna just poke in, like that. And I'm gonna pull up on the needle and show you how deep I am. And I'm gonna put in probably less than maybe 0.05. I don't really know. I don't really look. I don't really look at the needle. I'm looking at the tissue. And when I see it move and when I see it do what it needs to do, I stop. Then I look at the needle and see what I did, so I can do the same on the other side. So, all right, here we go. And I'm just gonna gently inject. And then I'll pull up. You can almost see the needle through the tissue. Do you see how? I can see the silver almost, and I can certainly see the blanching. Okay? So I'm where I want to be, and I'm just going to inject a tiny bit. Like maybe 0.05, sorry. And create a little bit there. Let's just do the same thing on the other side. Very superficial. You okay, hon?
Mm-hmm.
Am I killing you?
Nope.
Okay. Just let her rest a minute because I know she's nervous. I saw her tense up and such. You all right?
Yeah, I'm
Take some deep breaths. Relax. Those are the worst ones. You know, the middle ones are the worst ones. So, and her blood pressure's probably through the roof right now. You hate getting needles? Yeah. All right. So let's just do one right in the middle now. Yeah, this area is going to start getting a little bit numb because there's numbing medicine in this product. And that will make you feel better. So also, even the Vicross technology products all take on some water. So they're not hydrophilic like Ultra and Ultra Plus, but all HAs are hydrophilic, every one of them. So I tell them like, oh, you know, if you're happy with this, just wait. You're going to get another 10 or 15% improvement over the next few weeks as the product takes on water from the surrounding tissue. Okay. So I think I'm good there. this side was a little deficient to start with, so I may want to go back. And I think I'm just going to go and touch up that this one column, this one pillow, because I forgot that this was a little deficient. So I just put another 0.05 in there. So yeah, that's better. And one of the ways I like them to, if I see a little lump or bump, I will massage it, but I generally don't touch it if I like the way it looks. I just have them, you know, that maneuver that women make when they put on their makeup, but they go like, I mean, their lipstick, and they go like, whatever that is. You know how to do that?
Mm-hmm.
Let me see.
Oh, you already do it?
Yeah, yeah, that's good. That's all I think they need. Okay, so now let's do the fanning. So we're gonna go in here. I know that my last injection ended there, so I'm gonna go here and just go forward and then do my retrograde linear threads here. And I think if you keep the lip tense, it's less painful. You know, if it's loose, you kind of, it's more uncomfortable. So let's go into that space. And then I see I'm good. I'm going to do my retrograde threads. I usually just do 2 or 3 passes. Again, I'm doing, you know, probably less on her than most people because she doesn't need very much. And just get it off to a good start. Do I have anybody watching me?
Yep.
Watching this live injection from our lip intensive class at Aesthetic Mentor. Okay. I think for her I will do a little bit on the edge because I know she has more there and less here, so let's do a little bit on this side. See, now I know that I've opened that plane up because when I went in I felt like I just fell into air, like there was no resistance whatsoever. So I know that that plane's expanded from the previous injections, and I know that submucosal space is full.
Beautiful.
All right, so I'm going to just sit her up, and then you guys tell me, because I can't see her. You tell me how we're doing with her.
Beautiful.
So we'll see. You guys, let's see what Sarah. Is that enough, or do you want more?
Just a little bit
Yeah.
more.
Where do you want more?
Um,
Yeah, right in the middle. So let's do a little, like what you were talking about, doing it like on the vermilion border. Back, you do it. Doing it right on the vermilion border. Because I think if we just do a little bit like here, in here, we're going to make that middle part pop. And that's what she's looking at. She's looking at the central portion. She wants that part to be high, right?
yes, please.
Okay, so let's do a little bit right here, right? Now, when you're doing this vermilion border, you've got to be really superficial. Like, you see that? Like, it's almost through. And just, it's a really small amount of product. I don't even know how much it is. It's very small.
Oh, yeah.
Looks beautiful.
That's
Just
nice.
pops.
Amazing.
And then if I do a little tiny bit right there, the same on the other side of the Cupid's bow.
Were you right in the red on that? You were. Okay, gotcha. No white. What's it?
Right in the white roll, like right, because where the red meets the skin, it usually is like a little white roll, like a little white reflection, and that's where you want to be. But very superficial. Take a look, honey.
I like it.
Did I do it?
You did it.
Now the hard part is going to be putting something in the other side. And am I going to be chasing my tail? Oh, now this side's bigger. Oh, now this side's bigger. And you're going to go back and forth. So we have to make some decisions about that. Now I think this side is a little bigger than that side. And how much did I put in all together?
3.5.
0.35 so far. So I'm probably thinking to myself, maybe putting 0.2 on that side, you know, something. And where am I going to put it? Well, I know all she's going to really look at is the middle, so I might not do any more there. Maybe just do that, the part on the upper vermilion that we did, right on the edge. I might just do a little there and a little there. And if that looks good, I might just put a little bit out there and call it a day. That's how I'm thinking about it. So I can always put in more, but we'll see. So, as I look at you right now, tell me if you agree. It looks like now we've gotten this side bigger than that side.
Yes.
And so if I were to make this side the same as that, you would be happy? Or,
Yes.
Okay, all right. So I'm going to try to do that for her. So I'm going to come at it Go on any side you want.
Come over here.
How bad is the pain?
I'm good.
Say on a scale of 1 to 10.
4, 3.
So that's pretty good, right? We're getting stuck like that. But no bruising, no bleeding. Pretty comfortable for getting stuck in the lip. So yeah, I think we'll do a little bit more right here. And those are the worst ones, right? Barely move the plunger. Barely move it. Now I think I can do a little bit of fanning here, kind of like we did on the other side. So this plane has not yet been opened, but now as I'm injecting, I can see it opening up. I think I did 3 on the other side. Do your lipstick maneuver, please. Okay, thank you. It's magic. Let me just give that a minute, then we'll take a look, okay?
Mm-hmm.
You nervous?
No. That lips movement is like better if the patient does it like immediately after healing.
I think so. You know, the thing about these gels,
Yeah.
even the one that even Volux. Have you had Volux? Have you been using
Yeah,
it?
I will use a lot of children.
So even products like that have a high G prime, you still have 48 hours for the product to set up. These gels, even Volumen, all those gels, it takes really 48 hours before they really become like stuck. So you can manipulate them, you can smooth them out a little bit, you can do what you want to do, but after that, it's kind of done. So I usually tell patients, like if you do the face or the cheeks or something, or the jaw, don't sleep on that side, you know, for the first 48 hours. Put pillows on each side so you don't really put a lot of pressure on it, because you can change the outcome, you know, by flattening it out. So give me 48 hours, and they usually try to. I think I need to do a little bit more laterally, I think. I
Do
feel
you want
like,
to sit up?
what?
Do you want me to sit up?
Yeah, why don't you do that? Go ahead.
Watch out for your head.
You agree?
Yeah. Yes.
Take a look. We're talking about, so we're just doing a little bit more here to match that side.
Mm-hmm.
Okay. Do it. Is it? Well, isn't it?
Mm-hmm.
So it just felt so much easier because the product just filled that space, and I just felt like I fell into that submucosal space without even trying. And I can move the needle back and forth, and the skin doesn't even dimple because it's not really attached anymore, it's separated. So I think that's really a good sign. Okay. All right. You take a look and tell me if you're happy with that. And I think we got half a cc. 0.5?
Yes.
I've got a whole half a cc left, which is probably more than I need for the lower, but that's okay. It's okay. Are you good with that?
Yeah, I'm good.
Okay. So now what do you think her proportion is of upper lip to lower lip?
Almost the same. So
Almost the
it's,
same.
yeah.
So take a look.
Keep on
You
breaking
think
it.
your upper lip and lower lip are about the same.
Mhm.
We're just going to put a little bit in the mid portion of the lower lip to give you a little bit of that pouty, just fullness. It'll make the upper lip look better.
Okay.
Okay? I'm just gonna do- Actually, I can show them my fanning technique. I don't know what I call it, my sort of bolusing technique. It's like rolling fanning technique. So in order to kind of create what's been done there, what I like to do is, as I said, once I'm in the skin, I like to stay in the skin. So I'm going to go in, I'm going to bolus, but I'm going to keep moving my needle like that, like maybe 270 degrees, some number of degrees, so that I don't have to keep sticking her. Because once I've gotten in there, and once I start separating that plane, I want to stay there. I want to create like that little nice pillow that you commented on, because that's the best way to do it. So I'm just going to squeeze the skin like that. The same technique where we're going to go in. Also, at that point, I realized I should have used a new needle. That needle was a little dull. And see how she kind of winced a little bit? These needles are so small, they get dull very quickly. So when I do the next one, I'm going to change the needle. So I'm just going to do my little retrograde fanning with small amounts, but I'm kind of going in a circle so that I create that beautiful pillow. And that was 0.05, not even 0.1, 0.05, just a small amount. We'll do the same thing here. And also, I know that she's got product in here, so I feel comfortable knowing that I've got a little cushion, that submucosal space has been expanded. And that's another 0.05. Do your lipstick maneuver. Good, thank you. And then I think we should do a little bit here, a little bit here, and maybe call it a day. Just see. Maybe I'll just do 2 passes. I don't know. I just can't stop doing 3. I think I'm just programmed to do 3 no matter what I do. It just automatically happens. And sorry, I just want to massage that bit. Okay, let me do the other side. So it helps in the lip to use a product that's very moldable, that's very forgiving. Because if you don't, it's so dead. I love her lips. So nice. Guess it's so easy. Like there's literally no resistance. It's done beautifully. All right, do your lipstick.
0.7.
So I put in 0.2, 0.1, and 0.1. And let's see what Sarah thinks. Also remember, this product will get a little larger. We will gain up, we'll get a little bit fuller. It will get a little fuller as it takes on water for the next week or so. What do you think?
I like it.
You good?
Yep.
Let me just show the, I have a dress punch. Let me just show the audience, and you're going to be famous, 100,000 people watching right now. What do you guys think? Come on up. Are you watching it live? Are you good? Show the audience or the students, tell them absolutely. So that's a 0.7 cc's total. That's all. Yeah, I think we did 3.5.
2.
You got some thumbs up.
Yeah? Awesome. Awesome. All that matters is that she's happy. So if she's happy, we're all happy.
So you have the pillows.
So you've just been part of the middle, really, of our lip intensive class. The students are now going to go break off into groups. There's going to be, is it 1 instructor for every 2 students tonight, or one instructor for every 2 students? They're going to have a whole bunch of models. How many models do we have tonight? Too many to count. So they're going to be here all night injecting lips. 27 models. So it's going to be a wonderful night of injecting. Thank you for watching. Sarah, you happy?
I am.
Sarah's happy. We're good. Have a good night, everyone. See you next time.